It started with a fall. I fell off a piece of equipment and went in and got it checked and had a couple of small tears, but the x-rays showed that there was bigger problems. We were bone on bone and a lot of arthritis.
So the shoulder is somewhat a complex joint. The socket is very shallow, the ball is very large and round. On top of both the socket as well as the ball, there's cartilage, or the lining of the joint. Cartilage does not have great blood supply, so when it gets injured, it doesn't have a great way to repair itself. Now, when you lose that cartilage, then you experience the pain of arthritis.
Yeah, turning the key on the vehicle. I had to cross over with my left hand through the steering wheel to turn the vehicle on. So it's a small things you start thinking that you've taken for granted.
Being an agricultural society here, typically we're looking around what the farm schedule allows you.
When in the farm or ranch, you have 6 weeks that you have to be in that sling. You know, if I didn't have cattle, wintertime would be the ideal time. But what worked best for us is we got the crop in, we got all the cattle out on grass, got the heifers bred, and we just decided that, well, haying might be a little later, but we're going to take this break and do it.
Dennis had what's called an anatomic shoulder replacement, which means that I replaced his ball of the shoulder with a new metal implant. And in the socket, we put a piece of plastic that mimics the socket of the shoulder. It's usually done through an incision that's about this long, right here on the shoulder. And then therapy usually is about a 3-month process.
Pain relief. It was just tremendous. I mean, yeah, you had the pain of the surgery and the incision, but it was nothing compared to the pain that it was before. And I just find myself doing things that, man, I haven't done that for 2 years. You know, just be able to reach something without pain, and just small things. You go, wow, I haven't done that in a long time.
I really enjoy shoulder replacement surgery. And I really enjoy it because people's level of function dramatically improves, as well as their range of motion improves. The pain that they have decreases so much, and so it's a great procedure for both pain and function.
I would encourage anyone to do it just for that pain relief, so you can sleep, you can work, you can do things that you used to do. But I'm very happy with mine. I got great movement, and yeah, I had 0 complications afterwards, so I was very fortunate.